Buckle up, everybody, because today we are taking a deep dive into prenatal development.
Yeah, we're going to be looking at Chapter 4.
We've got Chapter 4 in front of us, which is,
It's a wild ride.
yeah, it's a wild ride. It is, from those first few days after conception.
All the way
All the way to birth. It's
the big moment.
the big moment, the big arrival.
Yeah, and we're going to unpack the science behind each stage and explore those mind-blowing transformations that happen.
Yeah, it's like we're going on a guided tour of the womb.
Exactly.
So Chapter 4 breaks down this journey into 3 key periods: the germinal, the embryonic, and the fetal.
Think of them like 3 acts in a play.
Right. Each with its own
dramatic twists and incredible feats.
Yeah.
And it's actually kind of amazing that any of us make it to this side of things.
Really?
Only about 31% of zygotes actually become newborns.
Wow.
So that means most pregnancies end before a woman even knows she's pregnant.
That's a pretty sobering statistic. It really makes you appreciate how delicate those first few weeks are.
Yeah.
So let's zoom in on Act 1, the germinal period we're talking about, the first 2 weeks after conception.
Exactly. The first 2 weeks, it all starts with that tiny ball of cells dividing and multiplying like crazy.
Yeah.
And it's a race against time as that little cell mass travels down the fallopian tube and tries to implant itself in the uterine wall.
It's like finding a parking spot in a crowded city.
Yes, exactly.
It's got to be just the right spot, or the whole thing falls apart.
It does. And as you can imagine, this implantation process is really crucial.
Yeah.
If it doesn't happen successfully, the pregnancy ends. And it's one of the reasons why most miscarriages actually occur during that early stage.
So those first 2 weeks are all about survival.
Yeah.
Really setting the stage for everything that comes after.
Right. And once that tiny embryo manages to secure its spot,
Right.
we move on to Act 2,
Okay.
the embryonic period, which spans from week 3 to week 8.
What happens during that period?
This is when the foundation for all the major body systems is laid down. It's like watching a blueprint come to life with incredible speed and precision.
So give us the play-by-play. What's the first structure to emerge?
First up is the primitive streak, which forms around day 14.
Okay.
And that is basically the central axis running down the length of the embryo.
Okay.
That's where the brain and spinal cord will eventually develop.
So it's the very beginning of the nervous system.
Exactly, the command center for the entire body.
It is. That's amazing.
And then just a week later, we see the formation of the neural tube,
Okay.
which is the precursor to the brain and spinal cord.
Okay.
And at the same time, the heart starts to beat, and tiny buds appear that will eventually become arms and legs.
Wait a minute. The heart's already beating at 3 weeks.
Yep, pumping away.
That's incredible.
Yeah, and by the end of the embryonic period, the embryo has the beginnings of eyes, ears, and nose, and even those tiny webbed fingers and toes.
Oh, yeah.
You see in those early ultrasound pictures.
Yeah, I'm picturing it all. It's like a miniature human is taking shape at warp speed.
It is, and what's fascinating is that this development actually follows a specific pattern.
Okay.
It's called cephalocaudal, meaning head to tail,
Okay.
and proximodistal, meaning near to far.
Oh.
So basically, the head develops first,
Yeah.
followed by the body, and then the limbs.
Oh, so that's why babies have those adorable oversized heads when they're born.
Exactly, and this pattern actually continues until puberty when it reverses.
Wait a minute. So during puberty, our feet grow first and our brains last.
It's a fascinating flip-flop.
Yeah.
But before we get to puberty, let's circle back to the embryonic period.
Okay.
Did you know that early on, the embryo actually has the potential to develop either male or female sex organs?
Really?
Mm-hmm.
I always thought that was determined at conception.
That's a common misconception.
Huh.
It's only around week 7 or 8, driven by hormonal and genetic cues,
Oh.
that one set of sex organs starts to develop while the other regresses.
It's amazing to think about how much is already determined in those first 8 weeks. The groundwork for everything is laid down, and even the sex of the embryo is becoming apparent.
Right. It's a remarkable feat of development, but the story doesn't end there.
Okay.
From week 9 onwards, we enter Act 3,
Okay. We're on Act 3.
the fetal period.
What new developments await us in the fetal period?
Well, the most obvious change is size. The fetus goes through a massive growth spurt, going from a tiny creature smaller than your thumb to a newborn about 20 inches long.
So we're shifting from building the foundation to refining and preparing for life outside the womb.
Exactly. In the early weeks of the fetal period, growth is the main event by 3 months. The fetus weighs about 3 ounces and is about 3 inches long.
Okay.
But then things get even more interesting.
Okay. I'm intrigued.
The 4th month marks a burst of activity.
Okay.
The fetus starts moving around, kicking, stretching, even doing somersaults
Really?
in the amniotic fluid.
Wow.
We also see fingernails, toenails, tooth buds, and hair starting to grow.
It sounds like things are really picking up pace, but you mentioned that the most important development during this time is actually in the brain.
Absolutely. While all those other developments are really amazing, the crucial development in the middle 3 months is the maturation of the central nervous system.
So the brain is starting to take control.
Yes, regulating heart rate, breathing, and even those early sucking reflexes.
So this is when the brain really starts to assert itself as the conductor of the orchestra.
Precisely. And this brain maturation is what ultimately allows the fetus to reach the age of viability.
Age of viability, what exactly does that mean?
It refers to the point at which a fetus, if born prematurely,
Okay.
has a chance of surviving outside the womb with specialized medical care.
Okay.
And that age is generally considered to be around 22 weeks after conception.
So even though babies born that early face an uphill battle, there's at least a possibility of survival.
Exactly, and with each passing day, those chances of survival increase as the brain continues to mature and other organs develop further. However, it's really important to remember that weight isn't the only factor determining a premature baby's chances of survival.
Okay.
Brain development plays a crucial role.
That makes sense. But let's go even deeper into the brain. What's happening at a neurological level during this critical period?
The middle 3 months are a period of incredible brain plasticity.
Okay.
We see rapid neurogenesis, which is the formation of new neurons.
Okay.
And by mid-pregnancy, the brain has already developed billions of these brain cells.
Billions. That's mind-blowing. I had no idea brain development was so intense during this stage.
It is, and during this time, the cortex, the outer layer of the brain, starts to become wrinkled and folded.
Okay.
And this allows the human brain to grow larger and more complex than those of other species.
So those wrinkles are actually a good thing. They're a sign of a highly developed brain.
Exactly. And at the same time, vital connections between different parts of the brain are also being formed.
So that's why babies can recognize their mother's voice right after birth. Those connections are already forming in the womb.
Precisely, the fetal brain is already attuned to sounds, particularly voices.
Wow.
And by the 6th month, it's forming those neural connections that allow for the recognition of familiar voices.
Okay.
But here's something that might surprise you. Even as the brain is busy generating billions of new neurons,
Yeah.
a process called apoptosis, or programmed cell death, is also happening.
Wait, so the brain is actually getting rid of some of its own cells. Why would that be?
It seems counterintuitive, but this programmed cell death actually plays a crucial role in refining and optimizing brain function.
Oh.
Think of it as a sculpting process.
Okay.
The brain is shaping itself, eliminating unnecessary cells
Okay.
to create a more efficient and streamlined network.
So even in the womb, our brains are already undergoing a process of streamlining and optimization.
It really is. And this pruning process actually continues throughout childhood and even into adulthood. It's a lifelong process of adaptation and refinement.
That's fascinating. So we've got a rapidly growing fetus with a brain that's firing on all cylinders. What happens during those final 3 months?
The final 3 months of pregnancy are all about fine-tuning and preparing for life outside the womb. Organ systems like the lungs, heart, and sensory systems undergo a final burst of development. The lungs practice breathing by expanding and contracting as the fetus swallows and spits out amniotic fluid, and the heart's valves, arteries, and veins go through a final maturation process.
So it's like a dress rehearsal for life, outside the womb, practicing all those essential functions they'll need once they're born.
Exactly. And remember all those synchronized brain connections we talked about?
Yeah.
They continue to strengthen during this period. In fact, by the time a baby is born full term, its brain is so developed that the cortex is fully wrinkled and folded with distinct lobes and areas,
Yes.
all interconnected and ready to go.
It's truly remarkable how much happens in just 9 months. It makes you appreciate the incredible power of the human body to create and nurture life.
It really does, but we're not quite done yet. The big moment still awaits birth.
All right, let's talk about birth. How does the body know when it's time to kick off labor?
Well, around 38 weeks after conception, the fetal brain steps in again, signaling a massive release of the hormone oxytocin.
And oxytocin, as we know, is the key player when it comes to labor contraction.
Exactly.
So it's all thanks to the fetal brain that labor gets started. How long does a typical labor last?
Well, that can vary quite a bit, but for first births, about 12 hours of active labor is average.
Okay.
For subsequent births, it's usually shorter, around 7 hours. Of course, these are just averages.
Right.
Some labors are much shorter and some can go on for much longer.
I can imagine those hours can feel pretty intense for the mother.
Yeah.
What are some ways to manage that intensity?
There are many different approaches. Some women find relief in a tub of warm water, which can be very soothing.
Okay.
Others prefer different positions for labor, sitting up, squatting, or lying down.
Okay.
It really depends on what feels most comfortable and safe for the mother and the baby.
It sounds like there's no one-size-fits-all approach to birth.
Absolutely. Each birth is unique,
Right.
and the best approach is whatever feels most comfortable and safe
Right.
for the mother and baby. Speaking of different approaches, let's talk about the role of doulas.
Okay.
Doulas are trained professionals who provide emotional and physical support to women during labor and delivery.
Okay.
They can be incredibly helpful in providing comfort measures, advocating for the mother's wishes, and just creating a calm and supportive environment.
That sounds like an amazing resource for mothers, especially those going through labor for the first time.
They can be invaluable, and once the baby arrives, the focus shifts to assessing their health and well-being.
Right. That's where the APGAR scale comes in.
Exactly. The APGAR scale is a quick assessment done right after birth to evaluate the baby's overall health.
Okay.
It looks at 5 key factors: heart rate, breathing, muscle tone, reflex response, and color.
So it's like a snapshot of how the baby is doing in those first few minutes of life.
Yeah. What's considered a good score?
Yeah, what's considered a good score?
Each factor is scored from 0 to 2, with a total score of 10 indicating a perfectly healthy baby. Now, most babies don't get a perfect 10.
Right.
But anything above 7 is generally considered to be in the healthy range.
So what happens if a baby scores below 7 on the APGAR?
That signals that the baby may need some extra medical attention.
Okay.
It could mean anything from needing a little help with breathing to requiring more intensive interventions. It's a quick way for medical professionals to assess the baby's immediate needs and provide the appropriate care.
That makes sense. So the APGAR scale is a vital tool in those first few minutes of life, helping to ensure that newborns get the care they need.
Precisely. Now let's shift gears a bit and talk about some of the medical interventions that are commonly used during childbirth.
Okay, let's unpack that. What are some of the common medical interventions that we might see during labor and delivery?
One of the most common is medication to either induce or speed up labor or to manage pain. These can range from medications that are similar to those used for headaches to epidurals, which are injected into the spine to block pain sensation in the lower body.
I know epidurals have become increasingly popular for pain management during labor. What about the practice of inducing labor? When might that be necessary?
There are a variety of reasons why a doctor might recommend inducing labor. It could be that the pregnancy has gone past the due date, or there might be concerns about the health of either the mother or the baby.
Okay.
Sometimes it's simply a matter of convenience, allowing for a more predictable birth experience.
So it sounds like there are both medical and non-medical reasons for inducing labor. Are there any downsides?
Well, like any medical procedure, inducing labor comes with its own set of potential benefits and risks.
Sure.
It can make contractions more intense,
Right.
which might lead to a greater need for pain relief. It can also increase the risk of certain complications like fetal distress or the need for a cesarean section.
That makes sense. So it's a decision that should be made carefully weighing the potential benefits and risks. Speaking of cesarean sections, when might that procedure be necessary?
Cesarean sections, or C-sections as they're commonly called, are surgical births where the baby is delivered through an incision in the mother's abdomen. They were once relatively rare, reserved for emergency situations. But in recent years, C-section rates have been steadily rising.
Why is that? What are some of the reasons for this increase in C-sections?
Well, there are a number of factors at play.
Sure.
Some C-sections are medically necessary, such as when the baby's in distress or the mother is experiencing complications.
Right.
But there's also been a trend towards elective C-sections where mothers choose to have a surgical birth for non-medical reasons.
What would be some reasons for choosing an elective C-section?
Some mothers might opt for a C-section to avoid the pain and unpredictability of labor, while others might have a previous C-section and choose to repeat the procedure. There are also concerns that rising rates of obesity and older maternal age might be contributing to the increase in C-sections.
It sounds like there's a complex mix of factors driving this increase in C-sections. But what about the risks associated with this procedure? Are C-sections riskier than vaginal births?
Like any surgical procedure, C-sections do come with certain risks. There's a longer recovery time for the mother, as well as a higher risk of infection and other complications.
And what about the baby? Are there any risks associated with being born via C-section?
Some studies have suggested that babies born via C-section might be at a slightly higher risk for certain health problems like asthma and obesity, but it's important to remember that this is an area of ongoing research, and more studies are needed to fully understand the long-term effects.
Okay, so while C-sections can be life-saving in certain situations, it's important to be aware of the potential risks and to discuss those risks with your doctor.
Exactly. And this brings us to a broader discussion about the varying perspectives on medical intervention during childbirth. There's a growing movement advocating for minimal intervention,
Okay.
viewing birth as a natural process that should unfold without unnecessary medical interference.
So it's about finding a balance between respecting the natural process of birth and harnessing the advancements of medical technology to ensure a safe and healthy outcome. It's about empowering women to make informed choices about their birth experiences.
You've hit the nail on the head, and this debate often plays out in discussions about home births.
Ah, home births. That's
Yeah.
definitely a topic that sparks a lot of conversation.
Yeah.
What are some of the considerations surrounding home births?
Well, home births have become increasingly popular in recent years as some women seek a more natural and personalized birth experience. They often involve midwives who are trained to assist with low-risk births.
So what are some of the benefits of having a home birth?
Well, for many women, it's about having more control over the birth environment
Okay.
and feeling more relaxed and comfortable in their own space. There's also a sense of empowerment and autonomy that comes with choosing to birth at home.
But what about the risks? Aren't hospital births considered safer?
Hospital births certainly have access to advanced medical technology and interventions should complications arise.
Right.
But for low-risk pregnancies with a qualified midwife present,
Okay.
home births can be a safe and viable option. The key is to carefully weigh the potential benefits and risks.
So like with many aspects of childbirth, it's about making informed decisions based on individual circumstances and preferences.
Precisely. And this brings us to another important aspect of prenatal development and birth potential problems and solutions.
Okay, let's dive into that. What are some of the things that can go wrong during pregnancy, and what can be done to mitigate those risks?
Well, it's important to remember that the vast majority of births are healthy and uneventful, but like any complex biological process,
Right.
pregnancy does come with certain risks, and these risks can begin even before conception if the sperm, egg, or uterus have been affected by the parent's health.
Oh.
In fact, research suggests that even a grandmother's health during her own pregnancy
Wow.
can impact the health of her grandchildren.
That's incredible. It really highlights the interconnectedness of generations.
It really does, but let's focus on the prenatal period. One way to think about potential problems is through the lens of risk analysis. Just like we make decisions every day to manage risk pregnancy, involves a series of calculated risks, and the goal is to minimize those risks and protect the developing baby.
So it's about understanding the potential hazards and taking steps to mitigate them. And are there times when problems in pregnancy are part of a cascade of events?
Exactly, and yes, sometimes problems that arise during pregnancy are part of a cascade of events
Like,
that can have a cumulative impact.
can you give us an example of that?
Sure. Imagine a scenario where labor is induced, which, as we discussed, can increase the need for pain relief like an epidural.
Yeah?
The epidural itself might then increase the likelihood of needing a C-section. And as we discussed earlier, C-sections can have their own set of potential risks and complications.
Right.
So you see how one intervention can lead to another, potentially creating a cascade of events.
That's a helpful way to understand how seemingly isolated events can have a domino effect.
Exactly, and sometimes these cascades can lead to complications like cerebral palsy.
Okay.
Cerebral palsy is a disorder that affects muscle control and movement,
Right.
and it was once thought to be caused solely by birth trauma. But we now know that it's often the result of a complex interplay of genetic and environmental factors, including prenatal insults like infections and insufficient oxygen to the fetal brain during birth.
So it's not just about what happens during labor and delivery. The entire prenatal environment plays a role. And speaking of the prenatal environment, we have to talk about teratogens.
Right. Teratogens are any substances or agents that can disrupt prenatal development and potentially cause birth defects or other problems. These can be anything from drugs and alcohol to viruses and pollutants,
Okay.
and even things like maternal stress.
Wow. So that list is pretty broad. What are some things that pregnant women should be aware of?
Well, one of the most well-documented examples is alcohol. Prenatal exposure to alcohol can lead to a range of problems, from mild learning disabilities to full-blown fetal alcohol syndrome, or FAS. And what's particularly concerning is that even moderate drinking during pregnancy can have negative consequences.
So the message is clear. No amount of alcohol is considered safe during pregnancy.
Exactly. And it's not just about substances. Things like exposure to certain medications, infections, or even high levels of stress can also have an impact on the developing fetus.
It sounds like pregnant women need to be incredibly careful about what they're exposed to.
Absolutely. It's crucial for pregnant women to be aware of potential teratogens and to take steps to minimize their exposure. And one of the challenges with teratogens is that they can have both visible and invisible effects.
What do you mean by that?
Well, some teratogens, like the drug thalidomide, which
Okay.
was prescribed to pregnant women in the 1950s and early 1960s,
Right.
caused very visible birth defects.
Right, like missing or malformed limbs.
Exactly. But other teratogens, particularly those that affect the brain, might not cause any obvious physical abnormalities.
So a child might appear physically normal, but still be dealing with the consequences of prenatal exposure to a teratogen.
Precisely. These are known as behavioral teratogens, and they can have long-lasting effects on a child's cognitive development, behavior, and mental health.
Wow. So the impact of teratogens can be far-reaching and long-lasting. Is there anything else pregnant women should know about these risks?
Yes, timing is everything different. Organ systems are most vulnerable to damage at different points during prenatal development.
Okay.
For example, the embryonic period,
Yeah.
which is the first 8 weeks after conception,
Right.
is a particularly critical time for developing major body structures.
Okay.
Exposure to a teratogen during this period can have devastating consequences.
So those early weeks are really make or break when it comes to teratogens.
Exactly. But it's important to remember that teratogens can have an impact at any stage of pregnancy, and the severity of the impact often depends on the dose and duration of exposure.
So it's not just about whether or not a pregnant woman is exposed to a teratogen. It's about the amount and length of exposure. It seems like there are a lot of factors at play here.
Absolutely. We also need to factor in genetic vulnerability.
Okay.
Some individuals are simply more susceptible to the harmful effects of teratogens due to their genetic makeup.
So even if two pregnant women are exposed to the same teratogen, they might not experience the same effects.
You're right. It's a very intricate web of factors that determines the ultimate impact of a teratogen on a developing baby.
It makes it even more difficult to understand the risks.
It does, and this complexity is what makes it so difficult to study teratogens and to give definitive answers about what's safe and what's not.
It sounds like the best approach is to err on the side of caution and to minimize exposure to potential teratogens as much as possible. And this is where prenatal care comes in, right?
Precisely. Prenatal care plays a crucial role in identifying potential risks and providing guidance on how to maintain a healthy pregnancy. Regular checkups with a healthcare provider can help monitor the pregnancy's progress, address any concerns, and connect women with the resources they need.
That makes sense so early. And consistent prenatal care is essential for identifying potential problems and getting the supporting guidance needed for a healthy pregnancy. And speaking of potential problems, let's talk about a particularly concerning one: low birth weight.
Okay, low birth weight. It's a significant public health concern associated with a range of health problems and developmental delays.
How is low birth weight defined?
Low birth weight, or LBW, is defined as a birth weight of less than 5.5 pounds.
Okay.
And within that category, there are further distinctions: very low birth weight, which is less than 3 pounds 5 ounces, and extremely low birth weight, which is less than 2 pounds 3 ounces.
So we're talking about babies born significantly smaller than average. What causes low birth weight?
There are several factors. Premature birth is a major one, as babies born before 37 weeks of gestation simply haven't had enough time to grow and develop fully.
Yeah.
But even full-term babies can be born with low birth weight.
So what are some of the causes of low birth weight in full-term babies?
Maternal health plays a significant role.
Yeah.
Conditions like malnutrition, infections, and chronic diseases
Right.
can impact fetal growth.
Right.
Substance abuse, including smoking, alcohol consumption, and illicit drug use, can also severely restrict fetal growth, and multiple births, like twins or triplets,
Okay.
often result in lower birth weights because the babies have to share resources in the womb.
So low birth weight is a complex issue with a lot of contributing factors.
It is, and unfortunately, the consequences of low birth weight can be far-reaching.
What are some of the long-term consequences of low birth weight?
Babies born with low birth weight are more likely to experience a range of health problems in infancy and childhood, from breathing difficulties and feeding problems to developmental delays and learning disabilities. And as they grow older, they're at an increased risk for chronic conditions like heart disease, diabetes, and obesity.
So low birth weight can really have a lifelong impact on a person's health and well-being.
It can, and it's important to remember that these consequences are not inevitable.
Okay,
Early intervention programs and supportive care can help mitigate the risks and improve outcomes for low birth weight babies. We'll talk more about this later.
that's good to know.
Uh,
So while low birth weight is a serious concern, it's not a life sentence. And there are things that can be done to help these babies thrive. Now, you mentioned earlier that the U.S. has a higher rate of low birth weight than many other developed nations. Why is that?
That's a question that researchers have been grappling with for a while, and the answer is complex and multifaceted. But one hypothesis is that access to prenatal care plays a role.
That makes sense. Prenatal care can help identify potential problems early on and connect women with the resources they need to maintain a healthy pregnancy.
Exactly. And the U.S. has a relatively fragmented healthcare system,
Right.
which can create barriers to accessing timely and affordable prenatal care, particularly for low-income women and women of color.
So it's not just about the availability of healthcare, it's about accessibility and affordability as well.
Absolutely. And there are other social and economic factors that likely contribute to the U.S.'s higher rate of low birth weight.
Break what?
Things like poverty, food insecurity, and exposure to environmental toxins can all take a toll on maternal and fetal health.
It sounds like low birth weight is a complex problem that requires a multifaceted approach to address social support. We need to think about healthcare access, social support, and those broader societal factors that impact maternal and child health.
You're absolutely right. It's not just about addressing individual risk factors. It's about creating a supportive environment where all mothers and babies have the opportunity to thrive.
All right, so we've covered a lot of ground here, from the incredible journey of prenatal development to the potential problems that can arise and the importance of prenatal care. But what happens once the baby's born? What can we expect in those first few days and weeks of life?
That's a great question, and it brings us to the final section of Chapter 4. The new family babies are born ready to interact with the world around them. They're incredibly responsive to their caregivers, and their senses are already highly developed. In fact, newborns have a whole repertoire of reflexes that help them survive and thrive in those early days.
Reflex, what are we talking about here?
Reflexes are involuntary movements or actions that babies are born with. They're hardwired into their nervous system
Right.
and serve various purposes. Some reflexes, like the sucking reflex, are essential for feeding, while others, like the rooting reflex, help babies find their mother's breast.
So these reflexes are basically survival mechanisms that help babies navigate those early days of life.
Exactly. And they're also a sign that the baby's nervous system is developing normally. In fact, doctors often check a newborn's reflexes as part of their initial assessment.
Okay, so we've got a brand new baby with a set of reflexes and senses ready to engage with the world. But what about the parents? What are some of the challenges and adjustments they might face in those early weeks and months?
Well, the postpartum period can be an incredibly joyful time, but it's also a time of significant adjustment for both mothers and fathers. Hormonal fluctuations, sleep deprivation, and the demands of caring for a newborn can take a toll on both parents' physical and emotional well-being.
Right.
And for some mothers, these challenges can lead to postpartum depression.
Postpartum depression, that's something I've heard about, but I don't know much about it.
Right.
Can you tell us more about what it is and what causes it?
Postpartum depression is a mood disorder that can affect women after childbirth.
Okay.
It's characterized by feelings of sadness, anxiety, hopelessness, and fatigue, and it can range in severity from mild baby blues to severe depression that requires professional treatment.
So it's not just about feeling a little down after having a baby. It can be a serious mental health condition.
Exactly, and it's important to remember that postpartum depression is not a sign of weakness or a failure of motherhood. It's a medical condition that can be treated with therapy, medication, and support.
What are some of the risk factors for postpartum depression?
Well, there's no single cause of postpartum depression, but some factors that can increase a woman's risk include a history of depression or anxiety,
Okay.
hormonal fluctuations after childbirth, sleep deprivation, stress, and lack of social support.
So it sounds like it's a complex interplay of biological, psychological, and social factors. And can fathers experience this too?
Yes, absolutely. It's important to remember that fathers can experience postpartum depression as well. They're also going through a major life transition, adjusting to a new role, dealing with sleep deprivation, and often feeling pressure to provide for and support their families.
So it's not just about supporting the mother, it's about recognizing that both parents need support during this time.
Absolutely, and sometimes that support needs to come from outside the immediate family.
What do you mean?
Well, it can be helpful for new parents to have a network of friends, family members, or even professionals who can provide additional support and guidance. This could involve anything from a trusted friend offering to babysit for a few hours, to a lactation consultant helping with breastfeeding challenges, to a therapist providing support for postpartum depression.
So it's about recognizing that parenthood is not a solo mission.
Yeah.
It's a team effort that requires a strong network of support.
Exactly. And one of the most amazing things about this whole process is how newborns themselves contribute to the bonding experience.
What do you mean?
Well, babies are born with an incredible capacity for social interaction.
Okay.
They're wired to connect with their caregivers,
Uh-huh.
and they communicate their needs through a variety of cues, from crying and cooing to making eye contact and smiling.
So they're not just passive recipients of care. They're actively engaging with their parents.
Exactly. And when parents are responsive to those cues, it creates a positive feedback loop that strengthens the bond between them.
It's like a dance where both partners are learning each other's steps and responding in ways that build trust and connection.
That's a beautiful way to put it. And one tool that's often used to assess this early interaction between parents and babies is the Brazelton Neonatal Behavioral Assessment Scale.
The Brazelton scale. What's that?
The Brazelton Scale, or NBAS as it's often called, is a test that's given to newborns to assess their reflexes, responsiveness, and overall neurological development. It involves observing the baby's behavior in a variety of situations, like how they respond to being held, how easily they calm down when they're upset, and how they interact with different stimuli.
So it's a way to get a snapshot of a baby's individual personality and capabilities.
Exactly. And it can also be a valuable tool for helping parents understand their baby's unique cues and behaviors.
It sounds like a helpful resource for new parents, especially those who are feeling a little overwhelmed or unsure of themselves.
It can be incredibly reassuring for parents to see that their baby is developing normally and to learn how to better understand their baby's individual needs.
Okay, so we've talked about the challenges of the postpartum period, the importance of social support, and the incredible capacity for interaction that newborns possess. But let's zoom out a bit and talk about the broader societal context of birth and new parenthood.
Yeah.
How do different cultures approach these experiences?
That's a great question. Birth and new parenthood are universal experiences,
Right.
but the way they're approached and celebrated varies widely across cultures. Some cultures place a strong emphasis on community involvement, with extended family and neighbors playing an active role in supporting new parents.
Oh.
Other cultures might have more formalized rituals and traditions surrounding birth and the postpartum period.
Can you give us some specific examples of those cultural variations?
Sure, in some cultures, the placenta is buried after birth as a symbol of the connection between the baby and the earth.
Mhm.
In other cultures, there might be specific dietary restrictions or practices for new mothers, designed to promote healing and recovery. And the role of the father can also vary significantly. In some cultures, fathers might be expected to take on a more active caregiving role, while in others, their role might be more focused on providing for the family financially.
It's fascinating how those practices reflect different values and beliefs about the birth and parenthood.
It is. And it's important to approach these variations with sensitivity and respect,
Yeah.
recognizing that each culture has its own unique wisdom and traditions.
Okay, we've covered the challenges of the postpartum period and the cultural variations, but let's circle back to low birth weight, something we touched upon earlier.
Yeah,
What's being done to help these babies thrive?
you're right. We need to dig deeper into that. Remember how we said those consequences of low birth weight
Yeah.
aren't inevitable?
Right.
A lot of that hope comes from early intervention programs.
Okay, so what do early intervention programs look like?
They can provide crucial support to families with low birth weight babies or children who have been exposed to teratogens. These programs might help address developmental delays, provide nutritional guidance, connect families with social support networks, and offer parenting education and resources.
So early intervention is a crucial investment in a child's future, giving them the best possible start in life.
Absolutely.
And on the topic of support, this chapter really emphasizes the important role that fathers play.
Absolutely. Fathers can provide invaluable practical and emotional support to their partners,
Right.
helping with everything from household chores to late-night feedings to simply being a listening ear. Research has shown that involved fathers have a positive impact on their partner's well-being and their child's development.
It's not just mom going through this huge life change. It's a team effort, and supportive partners are essential.
I completely agree. And it's not just about practical tasks. It's about emotional support as well.
Right.
Being there for your partner, listening to their concerns, and validating their feelings can make a world of difference.
Speaking of fathers, this chapter mentions something called couvade, where fathers actually experience some of the same symptoms as their pregnant partners.
It's true. Kuvada is thought to be driven by a combination of hormonal shifts, empathy, and the stress of impending fatherhood. It's a reminder that men are not just bystanders in this process. They are active participants whose physical and emotional experiences are deeply intertwined with those of their partners.
It's amazing how connected fathers can be to this experience even on a physical level. This chapter is full of interesting facts like that. But one of the themes that really stands out to me is the power of connection. We see it in the bond between parents and their newborns, the importance of social support networks, and even in those cultural variations surrounding birth and new parenthood we discussed.
That's a great observation. Humans are social creatures, and we thrive on connection.
Right.
And that need for connection is never more apparent than during the transition to parenthood. It's a time when we rely on our partners, our families, and our communities for support, guidance, and love.
Like we're hardwired for connection, especially during those vulnerable early days of parenthood.
Exactly. And the chapter challenges the idea that there's a single critical period for bonding between parents and their newborns,
Okay.
emphasizing that it's an ongoing process that unfolds over time through countless moments of interaction and caregiving.
So there's no need to stress about those first few hours after birth being the make it or break it moment for bonding.
Not at all. It's about being present, being responsive, and being attuned to your baby's cues.
Yeah.
It's those connections, those moments of shared experience that create the foundation for a lifelong, loving relationship between parents and their child.
Okay, so while early bonding is important, it's not about a single moment,
Right.
but rather a series of moments that unfold over time.
You're right.
It's about building that connection through everyday interactions and responsiveness.
You've got it. And as we wrap up this discussion of birth and the new family, I think it's important to circle back to something we touched on earlier, newborn reflexes.
Oh yes, let's dive into those reflexes a bit more.
Hmm.
It's fascinating to think about those innate abilities that babies are born with.
It really is. And these reflexes not only help babies survive, but also give us a glimpse into the intricate wiring of their developing nervous systems.
What are some of the key reflexes that we see in newborns?
Well, one of the most well-known is the sucking reflex, which, as we mentioned before, is essential for feeding or brooding. Babies are born with an innate ability to suck on anything that touches their lips, whether it's a nipple, a finger, or even a pacifier.
It's amazing how they just instinctively know how to do that.
It really is. And that sucking reflex is often paired with the rooting reflex, which helps babies find their food source. If you gently stroke a baby's cheek, they'll automatically turn their head towards the stimulation and open their mouth, searching for something to suck on.
So those two reflexes work together to ensure that babies get the nourishment they need. What other reflexes are we looking for?
Another one is the grasping reflex. You can see this when you place your finger in a baby's palm. They'll instinctively grasp your finger tightly, sometimes with enough strength to support their own weight.
I've seen that. It's amazing how strong their grip is for such tiny hands.
It is. Then there are some reflexes that are less about survival and more about showcasing the incredible development that's happening in a baby's nervous system.
Oh, what?
Well, one example is the Babinski reflex.
Okay.
If you stroke the sole of a baby's foot, their toes will fan out and curl up.
Oh,
It's a cute little reflex that disappears as the baby gets older.
okay, that's adorable. Any other fun reflexes we should know about?
There's the stepping reflex, which you can see when you hold a baby upright with their feet touching a flat surface. They'll make little stepping motions with their legs as if they're trying to walk.
Like they're getting a head start on those first steps.
Exactly. And then there's the Moro reflex, which is also known as the startle reflex. If a baby is suddenly startled by a loud noise or a sudden movement, they'll throw their arms out, extend their legs, and then bring their arms back together in a sort of embrace.
That one sounds a little dramatic. What's the purpose of that?
It might look dramatic, but it's thought to be a primitive reflex that might have helped babies cling to their mothers in our evolutionary past. It usually disappears by the time a baby is a few months old.
So these reflexes are not only fascinating to observe, but they also provide valuable insights into a baby's neurological development.
Absolutely. They're like little windows into the complex wiring of a baby's brain.
It's incredible to think about all the changes that are happening in a baby's brain and body during those first few weeks of life.
It really is. And it's a reminder that even though they might seem helpless, Newborns are incredibly complex and capable little beings. They are ready to connect, to learn, and to grow.
Speaking of growth and development, I think we've reached the end of this chapter. It's been an incredible journey through the world of prenatal development, from conception to birth and those precious first weeks of life as a new family.
We've covered a lot of ground in this deep dive. We explored the incredible journey from zygote to newborn, delved into the challenges and potential problems that can arise along the way, and highlighted the importance of social support, responsive caregiving, and cultural sensitivity.
It's been a fascinating exploration of this remarkable journey,
Yeah.
and I feel like I have a whole new appreciation for the complexities of prenatal development and the incredible resilience of the human spirit. As we're wrapping up chapter 4 here, one thing that really stood out to me was the discussion about the potential problems that can arise during pregnancy and birth.
Yeah, it can be a little bit of a heavy topic,
You can.
but I think it's really important for expectant parents to be aware of the risks.
Right, knowledge is power.
Exactly.
Understanding what can go wrong and knowing what steps can be taken to prevent or mitigate those risks can be very empowering.
I agree. And, most births are healthy,
Yeah.
but it's good to be prepared for those potential challenges.
Right. And one of the things that really stuck with me was the discussion about teratogens. Those substances that can harm the developing fetus.
Right. Anything that can disrupt prenatal development and potentially cause birth defects or other problems.
Like alcohol,
certain.
certain medications, even stress.
Yeah, it's a long list. And what's particularly concerning is that some teratogens, those that affect brain development, might not have any visible effects at birth.
Yeah. A baby might appear perfectly healthy, but still be dealing with the consequences of those prenatal exposures.
Exactly. Those are the behavioral teratogens, and they can have long-lasting effects on a child's cognitive abilities, behavior, and mental health.
It's a scary thought.
It is, and that's why it's so important for pregnant women to be aware of these risks and to work closely with their healthcare providers to minimize their exposure.
Absolutely. And there was a case study in the chapter about a listener who wrote in about her own experience.
Oh, yeah.
Her mother smoked and drank heavily during pregnancy, and her younger brother was born with learning and behavioral challenges that they believe were caused by that prenatal exposure.
That's a really powerful example of how those invisible effects of teratogens can have a real impact. And it highlights the importance of providing support and resources to families who are affected by these challenges. Early intervention can make a world of difference.
The chapter also goes into detail about low birth weight, which is a major global health concern.
It's linked to a higher risk of health problems and developmental delays.
Right. And as we talked about earlier, the causes are varied prematurity, maternal health issues, substance abuse, and multiple births can all contribute to low birth weight.
And the consequences can be really significant, impacting a child's physical health, cognitive development, and even their social-emotional well-being.
And it's disheartening to see that the U.S. has a higher rate of low birth weight than many other developed countries.
Right. It's a complex issue with a lot of factors at play, but the chapter highlights the importance of access to quality prenatal care as one of the key strategies for reducing low birth weight.
Right. Prenatal care can help identify those potential problems early on and connect women with the resources they need to support a healthy pregnancy.
Exactly. And it's not just about individual health care. We also need to address those broader social and economic factors that contribute to poor maternal and fetal health.
So it's a multifaceted problem that requires a multifaceted solution.
Exactly.
But despite the challenges, the chapter also emphasizes the importance of early intervention and a supportive environment for helping these babies thrive.
Right. Early intervention programs can provide crucial support to families with low birth weight babies or children who have been exposed to teratogens.
Like, what kinds of things do those programs offer?
Well, they might help address developmental delays, provide nutritional guidance, connect families with social support networks, offer parenting education and resources. It's all about providing those extra layers of support to help families navigate those early challenges and give their kids the best possible start in life.
That makes sense. It sounds like those programs can be a life.
They can be. And speaking of support, this chapter also really highlights the important role that fathers play in supporting their partners and their newborns.
Yeah, it's not just about the mother's experience.
Right. Fathers are essential partners in this journey.
Absolutely. And they can provide invaluable practical and emotional support.
Yes. Helping with everything from those day-to-day tasks like household chores and late-night feedings to just being there to listen and offer words of encouragement.
That emotional support can be just as important as the practical help.
It can, and studies have shown that involved fathers have a positive impact on both their partner's well-being and their child's development.
One of the most fascinating things I learned in this chapter was about couvaid,
Oh, yeah.
where fathers actually experience some of the same pregnancy symptoms as their partners.
It's true. Some fathers experience morning sickness, weight gain, mood swings, even those phantom labor pains.
It's amazing how connected they can be to the
It
experience.
really is, and it shows that men are not just bystanders in this process.
Right.
They are active participants whose physical and emotional experiences are deeply intertwined with those of their partners.
We've talked about a lot in this deep dive, but one of the big takeaways for me is this theme of connection.
Connection.
You see it in the bond between parents and their newborns, the importance of those social support networks, and even in the cultural variations surrounding birth and new parenthood.
That's a great point. Connection is really at the heart of it all.
Yeah, it's like we're hardwired for it, especially during those early vulnerable days of parenthood.
Absolutely. We need those connections to thrive. And the chapter even challenges this idea that there's a single critical period for bonding between parents and their newborns.
Oh, right. It's not all about those first few moments after birth.
Exactly. It's an ongoing process that unfolds over time through those countless moments of interaction and caregiving.
So it's not about getting everything perfect in those first few hours or days.
Sure. No, not at all. It's about being present, being responsive, and being attuned to your baby's cues. It's those connections, those moments of shared experience that ultimately create the foundation for a lifelong, loving relationship.
So it's not about a single moment, but rather a series of moments that unfold over time,
Right.
building that connection through those everyday interactions and responsiveness.
You got it. And I think that's a really beautiful way to think about it.
And I think it's a really reassuring message for new parents.
I agree.
There's no need to put so much pressure on themselves to get everything right in those first few hours or days.
Exactly. It's a journey, and it's about enjoying the process.
So as we wrap up this deep dive into Chapter 4, I hope you're leaving with a sense of awe and wonder about this incredible journey of prenatal development.
I hope so too. It's a reminder of the amazing resilience of the human spirit and the power of connection.
We've come a long way from that single cell to a fully formed human being.
Right, from zygote to newborn. It's a truly remarkable journey.
It is, and while each birth story is unique, we all share this common thread.
Yeah, we all started as that single cell, embarked on this incredible journey of development, and emerged into the world ready to connect, to learn, and to grow.
And speaking of growth and development, we've got a whole lot more to explore.
Oh, yes, we do. Those first 2 years of life are filled with amazing discoveries and milestones.
I can't wait to dive in.
Me neither. It's going to be an exciting adventure.
It is, and until then, dear listener, we leave you with this thought. We've learned so much about how much happens in the womb, how the brain develops, how the senses come online, and how the fetus even starts to learn. And remember, imagine the possibilities if we could tap into that early learning potential even further.
It's mind-blowing to think about.
It is food for thought. Until next time.